Hey there. I wanted to put this video together just to share what I found out. If you're like me, you're kind of a curious person and you have kind of had enough of the headlines that have been going around. And I wanted to dig in a little bit to the headlines and I wanted to share what I found out today. So let's start here with this headline from the Calgary Herald. And this kind of sums up my point. So you start to see a lot of these headlines lately, especially I'd say in the last few months, that headlines that are just trying to grab your attention. I don't know how many people would actually read the rest of this article or would go on Twitter and read past the headline and click on the article. But these headlines are getting more catchy. They're using more data in them, and they're really simplistic. And I think they're actually kind of dangerous because we're not fully understanding what's behind the data that people are using or the terms that they're using. And so I wanted to put this video together just to kind of show you what's going on behind the scenes and some of the things that I've uncovered that aren't sitting well with me when I start questioning the data and the things that I'm seeing. So, we start here, we look at this one, but there's other headlines as well. This is from May, but if I go to a recent headline, here's another one from the Calgary Herald, and it talks about, Alberta reported almost 5,000 new cases and 17 deaths over 4 days on Tuesday. It's not even good enough now that we report on a single day, that in order to get the numbers big enough and shocking enough, we need to do it over a weekend or multiple days and 4 days in this case. So if you're like me, you're starting to say, okay, well, what's going on here? We have the vaccines. They've been pushed out for a lot of this year already, and we're seeing these big numbers. What are behind these numbers? And so I started thinking about this, and I wanted to go in and start diving in and thinking, what is happening with cases, hospitalizations, ICUs, deaths. I want to know, different age groups that it's affecting. I want to know vaccine status. I want to know pre-existing conditions, things like that. Things that were actually reported on previously in the pandemic. We used to get reports all the time about, people that died and they had pre-existing conditions. And we just haven't seen that in the last few months. And that in itself is making me curious. So I thought I would have to, get a FOIP request to get some data out of the government. But, as just checking on the government's website, there's a lot of fantastic data here. There's a lot of numbers. And it's not all right. I think, like I said, there's some red flags here for me that I want to point out today. But there's a lot of data here. And so let's just start with this first page here. So this is the Alberta government website, and you come to this lovely page, and it's got some really great colors, and the numbers are here to kind of pop off the page and really try to impress you, or maybe not impress is the right word, but to like kind of shock you and say, wow, look what's going on. The problem is let's dive into these and actually see what's going on, and I don't know how many people are doing that. So that's what the kind of today's all about, and I wanted to do that. So here's where I started. I started with the characteristics. And I wanted to know, where are our COVID counts happening? What percentage of the population or what age groups is this happening in? And so there's these two really great graphs here, and there's better data just below it, and I'll show you in a second. But it's just showing, this is the count of how many people, and easily can see that, when we're looking at groups between 20 and 39, that's kind of the biggest numbers that group together probably have, if not, there's probably almost 100,000 here. So it's probably close to, when you look at all the other age groups combined, that the majority is probably here, very close to 50%. And whether you look at the count or the rate, it doesn't matter. And if you look at the count down here, again, it shows that the majority of COVID cases are in that 20 to 39 range. And the reason I think that's important is I'm going to show you in a second why I think that's important. So it's not only happening in those age groups, which, okay, that's fine. The data is what the data is, but I want to show you something in a moment. I'll come back to this. So keep these colorful graphs in mind. So those are characteristics. And then I go to the vaccine outcomes tab here, and this is where we really start to get into some of the data. And the first thing that pops off the page for me here is these bolded percentages. And I start reading through this, and the first thing I see is that they have already started to skew the data by including the date of since January 1st. And yes, we as a province started having vaccinations probably in the double digit thousands, so 10,000, 20,000 vaccines were administered. But I would argue that the majority of Albertans didn't have an opportunity to get vaccinated. We didn't see much momentum If you looked at a vaccination graph, the steepest part started in kind of mid-March. So I think it's unfair to say that, use the stats of saying since January 1st, the amount of cases or hospitalizations and deaths, were due to unvaccinated people. The truth is that most Albertans weren't able to get vaccinated until, kind of mid-March and into May. So already we're starting to see how we're skewing numbers here to make it more impressive or make it more scary, a bigger number than it probably should be. So that's the first one that really kind of stuck out to me. But as I keep going through the data, I say, okay, these numbers are fine, and it is what it is. It's interesting in here to look at the cases, active cases currently hospitalized. But then I start to read the fine print, and I'll put your attention to this. So what this note is about, it's a disclaimer talking about how they categorize vaccine status. So in order to be complete, partial, or unvaccinated, it depends on how many days it has been since your dose. And what the government is saying is that if you didn't have 14 days since your dose, you were going to be classified into the other category. So what that means is that if I go and I have my first dose and I get COVID before 14 days is up, I'm classified as unvaccinated. If I have my first dose and I'm getting my second dose and I get COVID within 14 days of that, I'm going to be categorized as partial. That is data manipulation. It is skewing our data. And I would be fine with that definition. That's fine. But has anybody been told that? Does the news, when they report on partial or unvaccinated people, are they saying that, hey, this is how we're categorizing these folks? No. So when people read the headlines of saying X amount of people have been in hospital that are unvaccinated, that's not entirely true, because your neighbor who just went and got vaccinated may have gotten COVID, and they're going to be counted as unvaccinated. They did the right thing. They did what we're told we should be doing, is getting our vaccines, but they're going to show up in the unvaccinated category, and I'm not okay with that. That to me is manipulation. So, and why? And again, okay, it's one thing to be manipulated, but why aren't we talking about this? Why aren't we saying, hey, this isn't right? Or at least if it is, then maybe we cut each other some slack and say, instead of pitting each other against each other, maybe we take a step back and say, wow, what's really happening here? What stats or what data is being provided? And yeah, you may have been we see that the unvaccinated, but is it really truly unvaccinated people? No, it's possible that some of these people that are ending up in the data saying that they're unvaccinated could actually have their first dose. So again, this is kind of the first one, maybe the second one now, that says, hey, something's not right here. This isn't the way that we should be doing things. And if we are, at least be clear about it. And thirdly, we should be asking the questions about why is it this way? Now, once we get past that, we start looking at the data here, and we start looking at the vaccination complete, partial, unvaccinated that we talked about. But then we start getting into the pre-existing conditions. And I find this interesting because everything that we've been told prior to the vaccines is that if you have a pre-existing condition, you're at more risk for severe illness with COVID. And that's not just me saying that. This is backed up by this is the CDC. This is the CDC saying this is the evidence that they have, peer-reviewed studies, that underlying medical conditions increases a person's risk of severe illness. And they keep adding to this. So this is a May 13th update. They've added pregnancy. They have substantial use disorders, asthma, blood disorders, cancer. It goes on. Smoking. These are things that they're adding, saying, hey, if you have these conditions, you're more at risk for having severe illness. And it goes on, and here it is. And one to point out here is this obesity. So obesity and hypertension are some of the leading indicators for severe illness when it comes to COVID. This is what we've been told. And again, I'll point to the Journal of American Medical Association. It says obesity and hypertension, increased risk with COVID-19. So these are some things that we've been told before. These have been outlined from reputable medical institutions, the government, the CDC. But yet, when I go to the Alberta government's website and I look at the fine print again, it talks about which pre-existing conditions, what they include. Now, if you're reading through the list, two of the things that you're probably noticing I just talked about that aren't included, obesity and hypertension. Why is that not included? What would our data look like? What would this data look like if we included those? Why aren't they included? The government themselves, if I go to another page here on the Alberta government website, they list hypertension as 88% of all cases that we've had in the province, 88% had underlying condition of hypertension. But yet it's not listed here as a pre-existing condition. Why is that? How does that affect the data? Would we know more if we included those factors? What would it change? So that's one thing that really kind of stuck out to me, is saying the data is not accurate here. And if I go a little bit further and I start looking into the data itself, I've noticed something else. Let's just use this unvaccinated column here with condition, no condition. Again, remember what I said. If we had pre-existing conditions, we are more likely to have severe illness with COVID. But the data is completely different here in Alberta. I guess we're an anomaly in the world. We've got, let's just look at, the 40 to 49s, or you can look at the 12 to 29, doesn't matter. A huge population with no condition. Okay, maybe that's unvaccinated. Let's go over to people with 2 doses. Look at this. We've got 40 to 49 years old, almost 700 cases in the past 120 days, double vaccination, but no conditions. How is that? So one is the data's missing something here. I don't know if they're not including all of the pre-existing conditions, or there's a mistake in the columns. But if we're screwing up this data and putting things in the wrong columns or not including, then what else is being messed up behind the scenes? So there's some quality issues here with the data that aren't making sense. Okay, so there's that piece. Then I keep going on to, we could go on to actually, let's look at, we could look at actually deaths. And deaths are, for me, obviously the most severe outcome of COVID, and terrible that this happens. But the data here is an interesting standpoint, because one is we're not hearing the right stories through this data, and I want to point that out to you. So remember when I went and we talked about the graphs. Remember those nice graphs where we showed that probably the majority of cases are in that 29 to 39 brackets, the years brackets. So we've got the majority of cases happening there. But look, in the last 120 days, we've had 4 deaths. The majority of cases are happening here, but we only have 4 deaths. Why isn't that a story? Why aren't we talking about how well people are recovering, or how well people are fighting off, the virus at that age? Why aren't we talking about policies that really affect maybe this age group? Because they have the most cases, but they don't have the most deaths. But we have the most deaths over here in these age groups. So why don't we change policy instead of blanket policies for everybody? Why don't we use data to support this and say, listen, we know that this group is probably getting the most cases, but they don't have the most deaths. But this group does. But nobody's talking about that, okay? And here's where I keep going down to deaths, that something really interesting is happening. And the data's here, but again, nobody's talking about it. It doesn't show up in the media, and it kind of blows me away why. So right now in the media, the story around deaths or anything, is really focused around the unvaccinated. Okay, you're talking about unvaccinated are filling up the hospitals. The majority of deaths are happening with the unvaccinated, but nobody's talking about this piece of it. And what it's saying here is that these are the COVID deaths in the past 120 days in Alberta. We've had 277. Now, if I add up the people that have 2 doses and people that have 1 dose, if I add up all these numbers, That's going to give me somewhere between 40 and 45%. And that's telling me that 40 to 45% of Albertans that have had at least one dose of the vaccine have also died. Where's that headline? Why is nobody talking about that piece of it? And I only put that out there because if people knew that, if we talked about that more, would we still be pitted against our friends, our neighbors, our colleagues, our family? Could we change the narrative of saying, hey, make an informed decision based on the data? You do whatever you want. It's your body. You do you. You protect yourself, your family, whatever it is. But did you know, do we all know the real story here? That 45% of people that even have one dose are dying? No, nobody's talking about that. And it's frustrating because instead of going against each other, why can't we use that energy to start to influence the policymakers, our mayors, our premier, the people making the people in the media that are reporting these stories? Why don't we go after them and say, hey, instead of just doing clickbait headlines, use the data and tell the real story of what's happening here. One last thing on the deaths I wanted to point out, because we got past 120 days in Alberta. I don't know why they use 120 days, but they do, and I'll use the same in my analysis here. So in the past 120 days in Alberta, we've had 277 deaths. I went onto the Alberta government website and I brought up the stats from 120 days in last year. So this is looking at May 8th to September 8th, 2020. So a year ago, how many deaths we have, what's going on. And if I add this all up, there's 117 deaths that we had in those past 120 days last year. Now, I know what you're going to say. You're going to say, we've got the Delta variant. It's worse. There's going to be more deaths, for sure. But we also have vaccines. So why aren't we talking about this either? Last year, we only had 117 deaths in the same period. And this year we have 277. What is going on? Why aren't the vaccines as effective as we were told they were supposed to be? We're told that, they were 90% effective. Well, now it's been changed and it's moving down to, in the 70s to 90. Well, it's not going to give you the same symptoms, someone who's unvaccinated. Well, they are. And you won't have an increased risk for death, but we are. 45% of people at least had one dose have died in the past 120 days in Alberta. That's a story. That's something that we all need to know. It's why we need to question each other. We need to influence the people that are making these decisions. So that's what I wanted to, those are some of the data things that I'm pulling out of here that just didn't sit well with me, that I'm noticing and wanted to share with you. But I want to leave on a positive note. So it's not all doom and gloom. What I wanted to share with you was this. And this is what I was hoping we could lead the 6 o'clock newscast with, was this graph. Because what this graph shows us in data shows that since the beginning of the pandemic, we have had, roughly it's about 261,000 cases of COVID. What this also shows us is that since that time, we've also had about 243,000 recoveries. And if you add the 243,000 to the current caseload of about active cases of about 15,000, that gives us about a 99% recovery. Now imagine the difference in the headline when you go to something like this that says the vast majority of this. And how about if we change the headline and said, wow, Alberta, we're at 99% recovery. Great job on looking after each other and yourselves. What would the impact be if we use data to actually be positive versus negative? And so that's what I want to just leave everyone with that's watching this video is let's use data to question the people that are making the policy decisions that are affecting all of us. Let's stop manipulating data to show our perspectives or our stance. Let's stop being pitted against each other, and let's start having some compassion, because we can't go we have to go past the headlines because the data is being manipulated in a certain direction. And we have to ask our own questions. The data is out here for us to look at. So I encourage everyone just to start looking and asking questions. That's all we can do. Hope you found this interesting. Thanks so much.